Thank you once again for joining me on the program, Your Doctor in COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue our conversations on the topic of the COVID-19 pandemic. And if you have questions or comments, please feel free to send them to 620-6275 on a WhatsApp message, or you may send an email to docandcovid@gmail.com. Today, as usual, I'm wearing my mask that covers both my nose and mouth. But for the rest of our conversation, I will take it off using the straps around the ears. And just so that you know, there's no one here next to me or within 6 feet that I'm putting at risk, and so therefore no one else is putting me at risk by any potential COVID exposure while we have this conversation. So we continue to take questions, we continue to take comments from viewers and listeners just like yourself. And it's amazing that people are sending in questions and comments about others who they care about, not necessarily about themselves. So here is one scenario and question that came in from a concerned girlfriend. And here is the question. My boyfriend tested positive and was told to isolate for 2 weeks. And this is the standard recommendation, not just for Guyana, but across the world. That has been so until a little bit recently. There's been some changes in that, but we'll discuss that at another time. So over the 2-week period of isolation, there was no symptoms in this young man, no symptoms. And the question is, after the 2 weeks, should he retake the test? And that's a very important question, because a lot of us are learning. And when we first started out this management of the pandemic, we had required 2 consecutive tests being negative before persons are released from hospital or released from quarantine facility or isolation facility. So first, let us understand what to do if the test is positive, regardless of having symptoms or not. If you are tested positive, then what should you do? First thing is to stay at home. Do not leave home except to get medical care. Now, there are lots of times you would think that some things are essential services that you have to perform, things that you have to do, and it is important to basically prioritize what needs to be done and stay at home as much as possible. Get friends, family, and those around you to be helpful, to drop off food, to drop off essential supplies, etc. The next thing to do once you are tested positive is to get rest. Take care of yourself. Get as much rest as possible and hydrate. We love to have soup in Guyana. There's nothing wrong with having a nice soup for nutrition. We love to drink lots of coconut water, orange juice. Stay hydrated. Those things are very important. Of course, you need to stay in touch with your doctor or your healthcare provider in case symptoms start to develop or they're starting to worsen. And if you are home and you are taking care of others, as much as possible, stay in a specific room and away from other people and pets in your home. So those are some basic advice. If you yourself are tested positive, what should follow that? Now, the WHO has come up with a very simple, easy way to remember what to do, how to release or reintegrate into society. It is essentially the 10+3 rule, or lucky 13. So if you would have had 10 days of isolation after symptoms or after you've tested positive, plus an additional 3 days of not having any fever or not needing any medications to control your fever. So if you have that combination of things, 10 days with no symptoms or after testing positive, plus an additional 3 days of no fever or no need for medications to control fever. 10 plus 3, that is considered safe for you now to return to society, to return to your job. So you do not need a test anymore to say, well, you are free to reintegrate in society. And that is a major change from the time we started the management of patients with COVID-19 to now. Remember, it's been about a year, so we've learned a lot from that time to now. And we know it is safe for persons to re-enter society after the 10 plus 3 rule. How do you determine return to work? That's a very important thing for us to know, because a lot of people, well, the majority of us, depend on the work that we do, not only for the service that we provide, but our families. That's how we provide for our families, especially if you have those persons dependent on your income, etc. So return to work has a couple of things that we look for. One is for this person to have had no fever within a 72-hour period. So that's 72 hours, of course, is 3 days. So you want this person to be fever-free or not needing any fever medication in that 72 hours. The next thing you want to evaluate is symptoms. So person should have significant improvement to symptoms or no symptoms at all before, at the time, they are going to return to work. And at least 10 days since the symptoms would have started. So you would have spent 10 days with symptoms and 3 days without fever, etc., and no symptoms, that it's considered to be a safe time for persons to return to work. The other concept as it relates to this particular question is contact tracing, because remember, it is the girlfriend who is asking the question about her boyfriend, and one assumes that if they have that kind of close relationship, there will be some kind of social contact, whether they are physically in contact or within a certain distance of each other. So contact tracing is very important in controlling the spread of this condition, because that is how it moves from one person to the next. So let's look at the first person as the one who is infected. That person will then have an interview with a healthcare provider, usually on the phone, and that healthcare provider will determine who this person has been in contact with for the past week, sometimes more importantly, the past 48 hours. And for each of those persons that would have been in contact with the known positive patient, the healthcare worker would then determine, either by phone call, messaging, etc., from those persons if they themselves have symptoms or not. In the group that has no symptoms, we would still recommend that they have the 14 days of quarantine. Even though they have no symptoms, but they were in contact with and exposed to someone who is known to be positive, we would recommend quarantine for that group. In the group that has symptoms, of course, you evaluate them and you treat accordingly, and you test once you have a suspicion, and you would manage those patients again with the same strategy of isolation and supportive care. So in recent times, in the last week or so, we have introduced antigen testing in Guyana. So antigen testing is the actual virus itself that we're checking, not the antibody, which is the reaction it produces in the human body, but the actual viral particle. It is not the PCR, which checks for the genetic material, but the actual viral antigen, which is a protein on the surface of the virus. So this tells you, if it's positive, that you have the virus now. So A viral test for COVID-19 tells you if you are infected now. If you test negative, you can still get infected in the future, whether it's near future or long-term future. If you test negative and you start to feel sick, you may need to get tested again. A viral test or a viral antigen test cannot tell you if you were infected before. In order to find out that information, you will need an antibody test, which can tell you if you had a recent or a long ago type of infection. So those are important concepts to remember about the viral antigen test that has recently been available or introduced to Guyana. We have to then now develop specific strategies and algorithms as to how do we use these viral antigen testing and who do we essentially send on to get confirmation by PCR testing. So it's important to have an algorithm. That's how we manage our resources. Not everyone needs to have a PCR, although that is the best, most reliable way of testing. But we can then determine the appropriate use criteria for those who need testing after doing their antigen. So let's say a person presents to the testing center. If they have symptoms or contact to COVID-19, whether they test negative or positive, you have different things to do. If they are negative, you can then confirm with the PCR. If they're positive, then you know that person has the virus. If this person comes to the testing center with no symptoms but had a contact, you can then retest this person to check, see if they have the antigen, or then use the PCR to confirm in this person. There are certain advantages and disadvantages when we look at PCR testing in general. And there are, of course, specific times when they're more useful and specific times where not so useful. So the advantages for the PCR test is that it tests directly for the virus and it gives an accurate result. It also has a high specificity rate. What is the disadvantage? Usually it is cost. It costs a lot more than the rapid tests. It takes some time for the results to be available, usually a day or two, because lots of these tests require a sufficient number of tests to be done so you have a good batch to be run at the same time, because it's not practical and sometimes not possible to run these tests one at a time. You have to have a critical number to run them in batches. And of course, it requires trained staff and personnel to actually do these tests properly and accurately so that we can have reliable results. The other concept that one can deduce from the question is the potential for reinfection. So reinfection with COVID-19 is possible, and we would consider someone reinfected if at least 90 days would have passed from their first infection and they then develop symptoms again and test positive. Around the world, we have seen reinfection in specific areas. For example, in the US, there have been a reinfected case up to 48 days after. In Belgium, there was a female who was 51 years old, and there was 93 days after the first infection. In Ecuador, 63 days between infections, and in Hong Kong, 142. So it is possible, but you can see that it is quite rare. If we can tell the number of persons and the country where they are, it means that it is quite rare. So it is possible, but we are grateful that it is not as prevalent. So I want to thank you once again for joining me today. And remember, if you have questions, feel free to send a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you once again.